Good afternoon, everybody. Thanks so much for joining us today. My name is Maura Inglis. I'm with the UCLA CTSI, and we're so pleased to have a wonderful speaker up for today to continue our series on dissemination, implementation, and improvement science. And today we have Isomi Miake-Lye from the VA in Los Angeles. And Isomi, I'll let you describe a bit about yourself as you think into your presentation today. It's a PhD in health policy and management from UCLA and is currently at the VA part of the Health Services Research and Development program, and is part of the Quality Enhancement Research Initiative QUERI program at the VA as well, and has a lot of background in implementation science and evaluation. And we're just really thrilled that we'll be talking about a framework for implementation science today and how to think about assessing organizational readiness and how to use those concepts in our work trying to introduce change into health delivery systems. So thanks so much again, and I'll let you kick things off today.
Thank you so much, Moira. So today I'll be talking about the work that Moira referred to our group, which is the Care Coordination VA QUERI program. And this is work that myself and colleagues in that group have been doing. So just to dive right in, we are Care Coordination QUERI VA program, and there are a number of different queries around the country, but ours is really focusing on improving patient-centered care coordination, specifically for high-risk veterans within the primary care setting. And so PACT is the VA speak for primary care. And that QUERI program is comprised of 3 projects. The first here is the ED-PACT tool, which is focused on improving information flow from emergency department to primary care. And this is an electronic medical record-based tool for patients that are discharged from the ED that may have urgent follow-up. And this project is the furthest along for us. So they started a couple years ago, and so they are done with the phase of implementation at the roughly 20 clinics that are within the greater Los Angeles area for VA, and they're looking to spread and scale outside of the VA in greater Los Angeles, so the VAs and maybe other parts of the country, and also conducting analysis of their initial implementation. Our second project is the Toolkit and Coaching Project. We're looking to improve coordination surrounding primary care and outpatient services, and doing so using a toolkit that they've developed as well as a coaching manual that's already been developed. And so that's where that project began, was really with the development of those components. And they are currently recruiting nationwide and will be implementing that project over the next 2 years. Both the ED-PACT and Toolkit and Coaching projects are considered quality improvement. The final project, which is Hospital to Community, is looking at post-discharge coordination from the hospital with community-enhanced care. And so this is a full-on research project that is using a community-partnered participatory research approach. They're currently piloting their project and will be implementing over the next 3 years. The people who come into who are on the first slide, who are my group, are considered the implementation core, which I guess was mostly a very long introduction to both the group and myself, but I serve as implementation core lead, and so myself and my colleagues are really meant to provide implementation science expertise to these 3 projects and to support the projects with things like developing measures and assessments or thinking about cross-cutting analyses and products across the 3 projects. Obviously, these 3 projects have very different interventions and different settings and contexts that they're working in, and so we have to provide some flexibility in terms of what we are developing for them. And one of the things that early on at the beginning stages of each of the projects they did was organizational readiness for change assessments. And so that sort of takes us to today's topic. And so organizational readiness for change has been defined by different people in different ways, but some of the key pieces are that it's sort of a multi-level issue that's looking at whether or not you are ready for some sort of implementation. And so some definitions, like the WINE definition, focus on organizational members being psychologically and behaviorally prepared to implement an organizational change, and that's really focusing more on the individuals there in that definition, whereas the definition by Holt and colleagues look much more at the attributes of individuals, but is also looking more at a collective nature. And so a little bit of a background for what this idea, this concept is that we were then going to dig into. And so for our 3 projects, when we want to identify readiness assessments, we ran into a little bit of a Goldilocks problem. So our projects had specific needs that they were looking at organizational readiness assessments to select or use as some sort of diagnostic, or they were going to use the assessment to figure out how they might need to tailor their intervention or the implementation. They also were hoping that they could use readiness assessment data to help explain outcomes, especially around implementation successes or barriers. Given that 2 of our 3 projects are quality improvement, there's a particular emphasis on parsimony and practicality. The participants in our projects aren't necessarily going to be able to sit down for hours to respond to a sort of assessment that we would want to conduct. And we went, as the implementation core, to look for readiness assessments. And what we found were a number of assessments that were too long, so they may have covered what we were interested in, but it may not be realistic to get somebody, coming back to that parsimonious aspect. They may not have time for over 100 questions. And then we also found some that were a better length, but were too narrow in their scope or too adapted to a particular implementation. So they are only asking questions about a particular IT intervention or about substances, and that doesn't apply in our projects. And so it looks like we were going to be off to making or adapting readiness assessments for our own use. And this is fine, and I'll come back and circle back to that towards the end of the presentation. But it also raised a larger question that in the work that we are talking about today, which is, what are the core components of organizational readiness for change to measure to get best implementation outcomes? We're seeing a bunch of different assessments looking at sort of different things and all calling themselves readiness assessments, and so we decided to dive into that. To do so, we decided to use a broad implementation framework here, CFR, the Consolidated Framework for Implementation Research, that captures a number of factors relevant to implementation research so that all the readiness assessments could be mapped to a single Rosetta Stone, so to speak. Since we couldn't map them to each other, we needed some way to ground our comparison, and CFR seemed like a good choice. And so for those of you who aren't familiar with CFR, it is a very broad framework that includes 5 main domains, each of which within each domain are nested constructs. And so you have intervention characteristics, which represents constructs like cost, complexity, relative advantage of the intervention you're talking about implementing. Outer setting, which may include things like consumer needs or regulatory mandates that surround outside the organization. Inner setting, which is composed of constructs including structural characteristics, tension for change, available resources, networks, and communications. The 4th domain, characteristics of individuals, is looking at the individuals involved in implementation, so their knowledge, their self-efficacy. And finally, the 5th domain is process, which looks at constructs including things like planning, executing, and evaluating your implementation. And so given how broad this is, it served as a really nice backbone for our analysis. And so just to look at that in a different way here, you'll see the same 5 domains here on the inner ring, so your intervention characteristics, your outer setting, and then each of the different constructs for different domains wrapping around the outside there. And so whereas a setting has constructs like culture, you'll see a process, again, the engaging, the planning, the executing. CFR takes it one step further for a few of the constructs in that they also then include sub-constructs. So are you engaging opinion leaders or champions? Is in your readiness for change, are you thinking about leadership engagement, compatibility, and relative priority within your implementation climate? And so this very broad framework seemed like it worked well for our purposes. to dig in a little bit further. So within the domain of process, the construct of engaging, you do see that they have these various different flavors of who is being engaged. Similar within inner setting, these are the other two sets of subconstructs. So for readiness for implementation and for implementation climate, you have leadership engagement, available resources, et cetera. And so using that as sort of our guiding post, we then went out and we collected up a number of readiness assessments, and we did so first starting a wonderful systematic review from 2014 by Young colleagues. That was a systematic review of organizational readiness for change measures, so perfect. We updated their search to current, and then we also included a few additional relevant references that we came across in the course of our work. We then screened each of the identified readiness assessments so that they were being deployed in a healthcare delivery setting, organizational readiness, and that they actually provided the assessment, which was crucial for the mapping exercise that we were about to undertake. And so from each assessment, we collected up individual items from the readiness assessment. And so we took roughly 1,200 of those items from the 28 different assessments found and collated them into a database. And then for each individual question or item, we did independent dual review to look at the tool of origin, which CFR construct or subconstruct we felt it mapped best to, the unit measurement, so was the question asking about an individual, the whole organization, their leadership, or their team. And we also looked to see whether or not the question was specific to a particular intention, so are you ready for X versus are you just generally ready for change, and then as well as a few other questions. And well, first of all, here are our 28 readiness assessments with roughly 1,200 items, and you'll see the largest here has 134 items in the top left corner, and then it makes down to the smallest down there with only 9 items in the smallest assessment that we identified. And so these 5 were all various versions of the same assessment. So these are all the organizational readiness for change from TCU, which is focused on addiction treatment. And these are all different adaptations with a different number of questions, but in that same assessment. We also see a few other multiples. So there are 3 instances of the evidence-based practice belief scale from Melnick colleagues. These ones were all identical in terms of how they deployed their questions, so they all used the same 16 questions. And finally, there were 2 instances of the Readiness for Organizational Change scale developed by Holt and colleagues. Again, these 2 were actually identical in terms of how they were deployed. Then the additional 18 readiness assessments that were one-offs that were developed for particular instances or particular settings or projects and not seen multiple times within a data set. Pulled all those questions, all 1,200-ish questions, and we mapped them to CFR. And what we found is that we had only 50 questions up there in the gray slot that were unmappable, which is roughly 4% of our total sample questions for items. And 2/3, or roughly 2/3, of the questions mapped to that inner setting domain, with another large portion mapping to the characteristics of individuals. Represented in the readiness assessment items were outer setting, process, or intervention characteristics. And those 50 that were unmapped were along the lines of very specific questions that we couldn't necessarily even map to any sort of larger constructs. So an example would be, does your practice use Alcoholics Anonymous programming? Well, we're not really sure in what way that informs the particular readiness assessment, and so we weren't able to map it to a larger construct. Taking those 50 aside, we look at the different constructs that were mapped to. So we mapped each question once and to one particular construct as best we could. And so what you're seeing here is the 1,186 items we did map, and you'll notice that there are 5 different constructs that are the most prevalent. And so while you have some questions falling into the outer setting, cosmopolitanism, patient needs and resources, or leadership qualities and culture, these 5 constructs are the ones that really represent the bulk of the questions, with over 100 items in each of these 5 buckets. These, the readiness for implementation and implementation climate, had existing sub-constructs from that I showed you a little bit ago, and so we used those when we were coding these 2 buckets because we had subcodes, and we wanted to dig in a little bit to better understand, okay, readiness for implementation, well, what does that mean? And so to start with readiness for implementation, which is our largest bucket, CFER defines readiness for implementation as tangible and immediate indicators of organizational change. And this had to be, in our mapping, intervention specific, in that the item had to really describe a particular intervention. It couldn't just be, oh, you know, general leadership engagement with the organization in general. It had to be engagement with your implementation process. I had 12 questions for access to knowledge and information about the intervention. And I'm going to give you some examples here of the 3 big buckets that we did find a number of questions for. So for leadership engagement, we found 46 items. And one example would be, this organization's most senior leader is committed to changes related to the move to the new hospital, and the move to the new hospital being the changes related to that being the implementation at hand. Defines leadership engagement as commitment, involvement, and accountability of leaders and managers within the implementation. Creating an other bucket, which covered other types of engagement or buy-in, as well as prior experiences that may make a increased readiness for implementation. And so these is an example of that. So people who work here feel confident that the organization can get people invested in implementing this change. So again, intervention specific, but it's by other than leaders, and we felt it well here. And finally, available resources, which had 95 questions just in that one category, which is defined as the level of resources dedicated for implementation and ongoing operations, including money, training, education, physical space, and time. And so an example here would be financial resources for initial and ongoing training are adequate. The first big bucket, the readiness for implementation bucket. And then the second large bucket for which CFER also provided subconstructs was implementing climate. And here defines this as the absorptive capacity for change, receptivity of involved individuals to an intervention, and the extent to which use of intervention will be rewarded, supported, and expected within their organization. Here, most of the questions fell into 2 of the subconstructs described by CFER, prevention for change and compatibility. And here also, all these questions are also intervention specific, so you're going to see references to the specific implementation at hand. Prevention for change, which is the degree to which stakeholders perceive the current situation as intolerable or needing change. An example would be, my unit needs guidance in developing services to address alcohol and drug behaviors presented by our patients, with being their intervention that they're trying to work on. Here for compatibility, which is the degree of tangible fit between meaning and values attached to the intervention by involved individuals. How does it align with individuals' norms, values, and perceived risks and needs, and how the intervention fits with existing flows and systems. So this example would be how it fits with your job. Using e-health technology can improve my efficiency. So the intervention is compatible with efficiency in your job. Another example here, thinking more about compatibility with leadership, is I think we are spending a lot of time on this change when the senior managers don't want it implemented. And so here's sort of one of those reverse coding types of questions, but it's still getting at sort of fit within your organization. Another 3 top constructs did not have subconstructs stated by CFER, and so we developed our own inductive subconstructs for coding so that we could better dig in and see what exactly was meant by other personal attributes, structural characteristics, and networks and communications. And we'll just take them in the order of the most populous. So starting with networks and communications, that has 184 questions. CFER defines as the nature and quality of webs of social networks, and the nature and quality of formal and informal communication within an organization. So this category really comprised a lot of the questions and items related to relationships. So we took a framework that we liked from Lanham and colleagues that describes relationship characteristics as our foundation for looking within networks and communications items. We added cross-departmental and organizational level communication for some of those questions about formal communication that weren't really digging into that relationship focus. And so see here is for respectful interaction, which Lanham and colleagues define as honest, self-confident, and appreciative interactions among individuals, often creating new meaning. An example would be different parts of the organization work together well. When conflict arises, it is often productive. And that second piece about being productive is especially characteristic of respectful interactions. The questions or items related to heedfulness looks something like, I am clear about my responsibility in the team, which represents the heedfulness Lanham and colleagues describe as interactions where individuals are sensitive to the task at hand and are paying attention to the way their roles and actions fit into the roles and actions of the entire group. And finally, the largest category, which was 79 items that were mindfulness, is represented by, I am encouraged here to try new and different techniques, which Lanham colleagues describe as general openness to new ideas and different perspectives, as well as novelty seeking. And you'll notice here the flavor of these networks and communications items a little different than those that we saw in the prior buckets because they're not intervention specific. So compared to prior ones, these ones are not talking about a particular implementation effort as much as they're just talking about how networks and communications work with your inner setting within your organization. Here's a little bit, another non-intervention specific, but now instead of being in the inner setting, we're looking at characteristics of individuals at their other personal attributes, which is a very nebulous topic, which Seifert describes as a broad construct to include other personal traits, such as tolerance of ambiguity, intellectual ability, motivation, values, competence, capacity, and learning style. And so we here just completely created de novo inductive buckets with our subconstructs, and we did so basically using a pile sort technique to divide up between these various subconstructs. Experience versus evidence was represented by 16 items, one of which here, clinical experience is more important than randomized controlled trials. So how much are the people in the items relying on research or evidence as opposed to their own experiences? Describe leadership. Other staff often ask your advice about program procedures. Skip down here to learning capacity, which is represented by 37 different items. Learning and using new procedure easy for me. Again, none of these are specific to a particular intervention, but they all capture different personal attributes. Now, for demographics and descriptives as well as miscellaneous, these buckets are maybe a little bit less interesting, so I didn't dive quite as far in, but demographics might be like describe how long have you worked in an organization or particular characteristics of that person. In a miscellaneous bucket, something about that person, but not necessarily related to any larger construct. So I have a responsibility to learn how to use technology to perform my work. With an example where it's not intervention specific, but it's also not really getting at any of these other categories. Finally, coming back to inner setting for the smallest of the big five, we have structural characteristics, which is again not intervention specific, and the 118 questions in structural characteristics are really addressing the social architecture, age, maturity, and size of organization, as well as sort of these other types of structural characteristics. So for policies and procedures, an example might be our medical group has well-developed administrative structures and processes in place to change. Again, intervention specific, just talking about your organization more generally. For workforce, larger support staff is needed to help meet program needs. And now this program here they're referring to is not the intervention, but just more generally the overrunning of your program. finally, IT infrastructure, more computers are needed in this program for staff to use. It's a pretty self-explanatory category. That wraps up the 5 big concepts that captured the large portion of the items we mapped to CFER. And we did end up looking beyond that at a few different analyses at the assessment level, which are now. So we looked at the assessments over time by size. So here you see on the y-axis the number of items in an assessment, and then the x-axis here is over time. The line is not a great fit. It is just a general indicator of a decrease in size, but it's a linear function that I would not necessarily very much weight on. However, it does show that for over the number of items is decreasing, which does seem to match the actual points that we're looking at. So again here, thinking back to the different types of assessments we saw, the big blue circles are those 5 different adaptations of the Organizational Readiness for Change assessment that was put together by TCU. Blue diamonds are the Melnick assessment. Every time that same assessment was used, and so obviously they match because they didn't adapt and they used the same exact items. As the same case with Holt. The 2 blue triangles are the Holt, right around 41 items. They are the same size. And then what you'll see with the yellow is that over time, there are more and more items hovering right around that 20 item assessment. So that's kind of interesting. You still do have a few up there with the 60 to almost 100, but the clustering is really happening closer to 20 items within those assessments. And then to look at this also over time is the number of constructs. So within CFER, if you're intersetting, you're looking at your networks and communications or your structural characteristics, how many of those are covered by different assessments over time? And so here, for instance, if you take the readiness assessment that was published in 1988 on the left-hand side, the dark yellow square indicates that there are 4 constructs that are core to that assessment. And the way we looked at this is 10% or more of their questions relate to those 4 different constructs, whereas the lighter shaded yellow, which is floating above it, is sort of a shadow. They actually cover in different assessments, the constructs within that assessment. However, 5 of those are covered with not even 10% of the questions. So they're very quickly cut, necessarily discussed in depth or a concentration of that assessment. So what you can see is that while there are assessments ranging with 8 to 13 different constructs covered, the focus of most readiness is 6 or few constructs. Makes because while readiness is a multi-level problem, you're thinking about a few popular constructs that are popping out. And CFER ended up working very well for our mapping exercise, so only 4% of the questions remained unmappable, and they were very specific, like that Alcoholics Anonymous programming example I gave. So we were really able to capture the vast majority of the questions within the framework, and most of them were in that inner setting or characteristics of individuals using those popular constructs, the ones that you see on the right here. And to boil down to kind of layman's terms, for change seems to address 4 fundamental questions. Do you have what you need for X, with X being intervention? Are people into X? Are your leaders into it? Are your frontline staff into it? Do you have that buy-in, that engagement that you need? Do people work well together? Are they communicating well? Wanted and needed. So do you have a problem that this thing is going to be solving? And do people want this type of thing to solve that problem? Well, you might say that, you have resources available, multiple levels of buy-in, a good of communication, and fit of your intervention with your context. So these readiness assessments demonstrate is that there's a need for tailoring to a particular project or a setting. So even though there are readiness assessments as early as 1988, new assessments are continually being developed up until we're doing our review. So it's not as though there's some coalescing around particular assessments as the gold standard yet. Religion and team functioning are critical components of organizational readiness for change, and they're pervasive. So while you might think that they'd mostly be captured somewhere like in those relationship dynamics that Lanham and colleagues describe within networks and communication, they also showed up in different places like readiness for change and some of those sub-constructs. So it's pervasive, it's items in various constructs. The work we did, so as Wine and colleagues found in their earlier review on organizational readiness for change, there's little consistency in terminology or conceptualization. So you have organizational capacity, organizational culture, or organizational climate, and then you also have assessments like readiness assessments, but also needs assessments and peers and facilitators assessments. And so pointing out the different types of assessments or concepts that are being captured can be a little bit nebulous. Really, identifying all the relevant literature is difficult without a standardized search term. So there's no meshed subject term for organizational readiness for change, and so identifying assessments can be tricky. I'll look at the published assessments included, and obviously readiness assessments or similar types of assessments are really happening in practice a lot more often than they're being published, and even projects that are published may not be publishing their organizational readiness for change assessment component. So that was definitely a limitation. We also counted by study so that you could see that there were multiple instances of using Holt or multiple instances of using the Melnick scale. And while this allowed us to describe certain things within the data set, it also kind of meant that we double counted certain items more than once within our database. Now, they were all different instances, but they were the exact same item within our database. So for projects, what ended up happening is for our particular projects, the EDPAC tool that was deployed first, they ended up assessing readiness during their buy-in process itself. So every new clinic they went to, they would have leadership interviews, and as part of their leadership interviews, they would be sure to ask a few specific pointed questions about readiness that fell within things like implementation climate, readiness for change, structural characteristics, and engagement. And then they currently are done collecting that type of information, given that they're done with their implementation, and they're analyzing their project findings, including readiness data currently. So the coaching project that we're working with, they just started recruitment more recently, and they're using a combination of semi-structured interviews with key informants as well as surveys, and that's currently underway. So they're covering similar constructs to the EDPAC tool, a number of questions about the networks and communications, which makes sense because they're really dealing with a lot more multifaceted care coordination than the EDPAC tool, which is a very message from one group to another very specific group. This is much broader. And so they are conducting semi-structured interviews with key informants at each site and then fielding surveys more broadly within each of those sites for most employees that are going to be touched by the implementation. For the hospital to community project, they're still piloting and refining their readiness assessment as well as their intervention. So we look forward to continuing to work with them related to their implementation and their organizational readiness for change assessment. Thank you so much for your time, and I think it's now.
Great, thanks so much, Isomi. That was extremely comprehensive. So we do want to open it up to questions at this point. We would ask, since we'll try to bring it up to everybody, if you are not asking a question, if you could please put your line on mute, and again, please don't put us on hold. That way everyone will be able to hear the conversation. So if you don't have a question right now, if you could please put yourself on mute. And also, it will help if you'd like, you can put up your hand, and that way we'll know that you want to ask a question. But just open it up at this point. Also, if you'd like to chat in the question, that's another way to make sure that we're able to get to you and that we have remaining. So I'll open it up and see if anyone has a comment or question they'd like to start out with. While thinking about questions, could I ask Isomi, I was wondering if you had a question just about the project teams as you presented the categories. I was wondering if the project found the categorization helpful or they find it overwhelming to see so many categories, and how did you handle that in the conversation about what might be most relevant to them in their work?
Yeah, we ended up really kind of having a very warm handoff or facilitated conversation because as we were going through this process, they were developing their assessments, and so we kind of listened to their needs and then helped direct them towards particular items that we thought may be useful to them. And then given that there are sort of these big 5 categories that a lot of people are touching in the readiness assessments, we offered suggestions for, oh, hey, you're already thinking about a lot of questions related to your communications within your group, but, have you thought about some of the structural characteristics? Or, have you thought about leadership engagement, which tends to be one that a lot of people think about. But a facilitated conversation we had. We didn't just throw this database at them because, yeah, it is pretty comprehensive.
Mm-hmm. Just toss another question while folks are cogitating. I was wondering if you got a sense, I know that this activity was focused on content mapping, and that's what you covered today. I was curious if you had a sense of the measures in terms of which are helpful. Certainly, it sounds like all of them are intended to be helpful for explaining why there may have been a barrier, or perhaps implementation not as intended, or where there might be variation across settings based on these characteristics. But I was curious, as you were doing the content mapping and assessment of items, the question was kind of explicitly part of the work about, or if you had an informal sense of the proportion of measures of readiness that are useful for kind of explaining versus measures that might be more conducive to change. That is, those where if a project take those measures, they might be able to actively work those measures and change them, versus those where they wouldn't be so useful as both an assessment and also something that you would actively work on.
So, to take a couple examples from our particular project, the EDPAC tool, they already knew that they were implementing at all Greater Los Angeles sites. So their assessment wasn't going to be picking necessarily from one or another, but they could potentially tailor their intervention based on what's found. And so their questions were more diagnostic in terms of the structural components, because those would be the things that they might need to be cognizant of in terms of their implementation. Whereas some of the other questions are more for analysis later, because you can't necessarily change leadership engagement if the leaders are not engaged. It might be good to know in terms of tailoring your implementation, but it may end up just being more of an explanatory factor down the road. And so I think the assessments that our groups used ended up being sort of blended in that way, in that some of the questions were probably more for just analysis down the road, whereas others were diagnostic in terms of helping figure out exactly they were going to be dealing with once they got their implementation underway. And then in terms of more broadly speaking of the data set that we were looking at for this assessment, I think the same holds true. So some assessments were very broad and just more agnostic in those non-intervention specific ways. So like, do people in your place get along? Like, are you a happy family? Were sort of the undertones of some of the assessments, whereas others were, hey, you have a specific intervention that's developing using IT, and this is going to help you diagnose exactly which structural characteristics or IT components you are going to need or should have already underway in order to be able to do this implementation. So I think it ranges. And I should mention that the very first steps that led to that systematic review was there's a nice decision tool online that you can fill information about your project out, and it will recommend a couple of readiness assessments from that systematic review that you can check out. And that was the first thing we did, and none of them quite fit, but it's another attempt. So while we're doing this very broad-based comprehensive analysis, they're doing sort of a different version where you can kind of go give a little bit of information about your project and see if you can't find a match within an existing set of readiness assessments.
Great, thanks so much.
How do you want people to ask questions?
I was just thinking what I might do is read out the questions we have in the chat, and then just one. Would that work for you, Isomi?
Great.
So we have a couple questions in chat. I think we have time to get to all of them. I'll just maybe just to be expeditious, I'll read them out. So the first one is asking if you could talk about how organizations use these tools. Do they just provide information that they act on as they see fit? And is there ever a score that indicates whether an organization is ready? And then do you ever reassess?
So related to the reassessment piece, that's an active conversation they're having because while obviously the assessments are geared at readiness for change, thinking more prospectively, a lot of the questions you could change the tense and it would be an assessment of implementation. And you could kind of collect multiple time points. And so that's an ongoing conversation our projects are having. But it also brings into this larger question of sort of, is really a distinct concept? And if so, how is it distinct from other diagnostics you might take of context more broadly? And then, sorry, what was the first part of that question? Don't mind reading it.
The first part of the question is how organizations use the tools. Do they just provide information that they act on as they see fit? That's the first part, which I think you somewhat addressed when you were responding to my question. The other is there ever a score that indicates whether an organization is ready?
Right, and so some readiness assessments that are floating out there will say like you could score like a readiness score. But that can not be very helpful, and it comes back to the first part of your question because, for instance, with ED, our project, we were pretty much dated that like we were going to be implementing at all the sites at DII, and so it didn't really matter whether or not they were eventually going to have to be ready because we were, going to be implementing sites, and so I think we did change the sequencing to be responsive to who was more ready, so that the more ready folks were going earlier in our implementation. Eventually they all kind of had to get there, versus our coaching project, which is actually specifically using the information to find more ready sites, and they are implementing at more ready sites, as opposed to folks that might have more barriers that they might not be able to address with their toolkit and coaching. So different versions for different projects within our experience. And then in the literature, I think you'll find the same, where there's sort of a variety of ways people are approaching this.
Great. We have two questions queued up in the chat, and again, if folks want to jump in after that, feel free. The next question is, in cases where existing scales were used, such as Holt et al., did they change the wording of the questions to match specific interventions? For example, rather than, I think the organization will benefit from this change, was it changed to, I think the organization will benefit from care coordination?
Right. I think in the specific example of Holt, the questions were not changed, but I think maybe it was Melnick, maybe it was Holt. I'm not quite sure, but to say yes, sometimes. And so sometimes they would keep the wording the same, and then sometimes there were slight tweaks that were made for particular circumstances. Obviously, the ORC item that was over 5 different implementations, the 9 questions did look a little bit different than the 134 questions in terms of their phrasing.
One additional question, which is asking if you could explain the difference between are people into X and is X wanted and needed?
So that was just my layman's way of describing it. Our people into it is really that engagement piece. Our leaders in doing this, our front staff into doing this, and sort of taking those levels and addressing how much buy-in you have. Whereas the piece, is it needed and wanted? You know, do people see that there's a problem? You're not going to, even if you think, oh, this is a process, if you don't think there's a problem that needs things, you probably don't want the tool. So I guess it's more related concepts, but or questions. But you know, do you really think that you have a problem that needs solving? Do you have attention for change? And then, you know, is this tool going to fix this, as well as just having more general buy-in to like be wanting to be involved in the implementation? Because even if you do want it and need it, you may not feel like you're the person who needs to be involved in that process. So, you know, maybe the leaders think that this is a great idea for frontline staff to take care of, but they themselves want to stay out of reach. And that's an example kind of based on experience from interventions that we've had to implement, where not necessarily in this project, but or in our program, but where, you know, yes, of course, that's a huge, care coordination is a huge priority. It's an 11 out of 10, you know, but me personally, no, I don't have the time to be engaged. And so, you know, thinking a little bit about those different piece engagements.
Thanks so much. So I don't know if Allison or Catherine, whose questions I just read, would follow up on any of those responses. So if you would like to, please feel free. I think we have one or two people who had their hands up, so feel free. I think you're all able to, you should all be able to be heard. So feel free to either pose one or two last questions, or again, if you would prefer to chat your question, we're happy to read it out. Maybe one last question, Isomi, and then we would love to have everyone's evaluation, so we'll load that up in a moment and get you off the line on time. I was curious, Isomi, after doing this mapping process, your thoughts about the process that perhaps are more broadly done in the VA or in the Health Services Research Department, your thoughts about the use of readiness. Do you think that readiness assessments, that is work that you did, help other projects in thinking about what they may want to include, or do you think there was already a pretty significant use of readiness assessments as part of the undergoing work?
So obviously CFER is developed by a group of VA folks, and there's also the, it's ORCA, developed by Christian Helfrich, who's also a VA person. And so I think the VA and QUERI in more specifically, which is, you know, a subset of research that is very much the Q flavor, implementation science flavor, have been primed to think about organizational readiness for change in context more broad for a while now. Whether or not their work in that area has always been very explicit in their publications in terms of the assessments that they've done of context or readiness, maybe less so, but this is definitely not a brand new concept within our research world. And I think more of it is just the ambiguity around these different terms that people are using. So if you're saying you're doing a needs assessment, is that the same as doing a readiness for change, organizational readiness for change assessment? And I think that's the piece where within the VA we've been doing a lot of thinking about, you know, what these different terms mean and how to best assess them. And then another piece that seems to be really interesting, so I presented this work at our research meeting this summer, and some of the questions I got were definitely about, you know, linking types of measures to outcomes, right? So, okay, can we always just say that, you know, if you score low or you're responding negatively to X, Y, or Z construct, you know, like that is going to have a negative association with implementing outcome X, Y, or Z, you know, like, will it mean that there's low fidelity? Will it mean that there's low, you know, adoption of your intervention you're doing? And so I think we're kind of starting to think about that next step of, which is really exciting, of, you know, how making the data work for you and what the data will mean. So like if you do a readiness assessment, really being able to judge a little bit more what that might mean for your implementation.
Great, thank you so much. Really appreciate it. That was incredibly helpful and idea stimulating. And we've just put out the discussion poll, I think. So please do, everyone on the call, give us your feedback. And I think that provides an opportunity for you to let us know if you have any remaining questions, and particularly if the topic of organizational readiness tools could be used both for understanding more about, as you were just saying in your last comments, Isomi, sort of predicting the likelihood of success or fidelity, and or providing information that could actively be worked on during the implementation to try to increase the chances of success or use an explanatory way. If there's interest in any or all of those applications, those may be topics that we could surface in future DII calls. So do give us feedback about what might be most helpful to you in your work. This is addressed to everybody on the call so that we can have these conversations going forward. I just wanted to thank you again, Isomi. If you have any last comments you'd like to make, please feel free to do that.
No, nothing much. Just thank you all so much for coming and listening today. And if you have any questions or further comments that you'd like to send, the folks on the call do have my contact information. It was also on my last slide, so happy to hear from anybody as well.
Wonderful, great. Well, thanks so much.
Thank you, Isomi.
Thank you.
Yeah, thank you. So we'll have our webinar on December the 13th. So that's the Wednesday. At the usual time, 12 to 1 p.m. Pacific time, and we'll be sending the announcement very soon with the speaker. And after that, we'll take a break for January because it's close to the holiday season, and we'll be having our first webinar of the year in February. So, but you'll just hearing from us pretty soon for the December 13th webinar.
Great. So much, Isomi, and thank you so much, everyone, for joining, and we look forward to talking with you again in December.